What is the history of Medicare Part D catastrophic coverage? Imagine facing huge prescription drug bills that could wipe out your savings. That's where Medicare Part D's catastrophic coverage comes into play. Let's explore how it all started and how it has changed over time. Medicare Part D was created by the Medicare Modernization Act of 2003. It officially launched in 2006 to help seniors and people with disabilities pay for prescription drugs. The program used private insurance plans to deliver coverage, with a structure that included a deductible, an initial coverage phase, a coverage gap called the donut hole, and then the catastrophic coverage phase for very high drug costs. The catastrophic coverage part was designed to protect people from spending too much out of pocket. When drug costs hit a certain high threshold, beneficiaries would enter this phase. At first, in 2006, they paid only 5% of their drug costs during this phase. That meant even after reaching the high cost limit, they still paid a small part of their bills. Before Medicare Part D, there was an earlier effort called the Medicare Catastrophic Coverage Act of 1988. It aimed to cap out-of-pocket expenses and expand drug coverage, but it was repealed shortly after due to political disagreements. That showed how sensitive and complex these changes could be. Over the years, lawmakers worked to make the program better. The Affordable Care Act of 2010 helped by gradually closing the donut hole. This meant seniors paid less during the coverage gap, making medications more affordable and encouraging them to stick with their treatments. A major change happened in 2024. The 5% co-insurance requirement in the catastrophic phase was eliminated. Now, once seniors reach the high-cost threshold, they pay nothing for covered drugs for the rest of the year. This change helps protect seniors from unpredictable and high medication costs. In addition, the Inflation Reduction Act introduced a cap of $2,000 on out-of-pocket drug expenses each year. This means seniors will not have to pay more than that amount, no matter how high their drug bills get. These reforms mean health plans now have to adjust their coverage and costs to meet new rules. Seniors benefit from clearer, stronger protections against very high drug expenses. The goal has always been to make prescription drugs more affordable and less stressful for older adults. So, the history of Medicare Part D catastrophic coverage shows a journey from initial high out-of-pocket costs to now offering more financial protection. It has evolved through legislation and policy changes to better serve the needs of seniors facing expensive medications.